I'm Dr Shagun Aggarwal. I'm a specialist plastic surgeon and I work at the Sydney Adventist Hospital, Royal Prince Alfred and Prince of Wales. A tummy tuck's quite a broad operation, so it varies from what people call like a mini tummy tuck to a tummy tuck, or what plastic surgeons will call an abdominoplasty, to something more than that, which can be a procedure that not just addresses the tissue at the front of the tummy, but all the way around. So I guess who's going to be eligible? It's generally women who desire an improvement in that area of their body, and so it'll be the people who are very conscious of their self-image. So there could be just a young mother who's out at the beach with their kids. That's usually, I'd probably say, the most common group. So they've had some laxity in that area created from pregnancy. The skin, they're usually quite fit women who've gone out and lost all the weight, but the skin quite hasn't been lost. I'd say that's probably the biggest group. The other people are just people who worked on losing their weight, and they've lost some degrees of weight, or and again don't like their appearance in that area. And then there's the other category where people have lost a lot of weight. So they're they've got massive loss of weight, 50, 60, 70 kilos. And in those people, not only do they have an excess of skin and fat in the front, but they have it all the way around, and in fact have it all over their body. So if we go back to the patient who might be eligible for a mini tummy tuck. So a mini tummy tuck is someone for people who don't have enough loose skin that you can take out everything from their belly button down to their pubic hairline. So they have a little bit of loose tissue, but not that much. But it's certainly noticeable and they want something. So in those people, what we can do is remove a part of that skin. So we keep the scar fairly short, and you remove some of the skin. And really the only disadvantage is that you may have to lower the belly button. And so if we lower the belly button, I usually try and only lower it a few centimeters. And what we can do is from that small incision, go under the belly button all the way up to their rib cage. And the real improvement that we can target is not just the skin we've removed, but also tightening of their muscles underneath. So the small scar gives us access to do that all the way up to their rib cage. We tighten all of that, and then we lower the belly button just slightly because it looks strange if you do that more than that, and keep it a small scar. So it's actually a really good operation for someone who wants an improvement in that contour. And like I said, I think it's not for the people who are vain. You distinctly see it in people who it affects their confidence. It really changes the decisions they make. So they may not want to wear a bikini, or they may not want they may not even want to go to the beach because they'll be conscious of that. So I think it's a really good operation. The majority of people will fall in the middle category, which is where it's a full-fledged tummy tuck. And so what does that involve? That involves everything from the belly button down to the pubic area and out to the hip bones. And they've got enough loose tissue, whether it be skin and fat, and we can remove all of that in that operation. Again, it's more than what the eye can see. So while we do that, we again go all the way up to the rib cage. And while we're there, we tighten all of the muscles. So the underlying muscles, which again get separated in pregnancy, are now brought back in the midline. Interestingly, also women who go through pregnancy or increase in weight can sometimes have a little hernia next to their belly button. We can repair that at the same time. So while we've done that all under the skin, we then move that skin down. The scar that they'll end up with is a long scar from hip to hip and one around their belly button. A common misconception is that people think that we're recreating the belly button. We're not. It's the old belly button that was always there, but the skin over it has all been moved down, and then that belly button stays where it was, but it ends up with a scar all the way around. So again, I think that operation is excellent at, the improvement it can create is phenomenal. So for someone who would never think about wearing your bikini or even exposing that area, it can really transform a patient's confidence. The third category is the person who's had a massive amount of weight loss, where you just think we can do that, but that's not going to be enough to improve that person's contour. And those people really need that operation at the front carried all the way around. And that's called a body lift. And a body lift procedure, we actually start with the patient face down, and we actually address the loose skin at the back, and we go all the way to the midline, and the loose skin goes all the way down to their buttock, and we actually lift all of that up. Keeping in mind that we're actually going to make the front tighter, so we don't want to make the back too tight. And then when we flip them around to the front, we do the same operation as we would have done in the other patient. But in all of these people, I think the recovery can be a little bit similar. What I say is, you may spend the first 2 to 3 days in hospital just because you kept back up with your leg up and your tummy feels quite tight. So we're very careful in getting them to walk. We want them to walk early, but with being a bit careful and in a place where they've got a lot of help. But once they go home, they're not allowed to lift anything, do anything heavy, walk a little bit bent over, and slowly straighten up. And for all of those people, I don't let them do any heavy lifting for 6 to 8 weeks. Again, because the thing that you don't see is the muscles that we've repaired underneath, and we want them to be super strong before they do anything. But I think the results of a tummy tuck operation can be fantastic, and they can really be life-changing. And yeah, it just depends on which category you fit in. A tummy tuck operation can be, totally life-changing for, not only the person's appearance, but I think what it does to their confidence. And it can really transform a person in terms of, what they do in terms of shopping, the clothes that they buy, their social interactions with people, and within their own family, with their partner, and also with their kids.